You can really see a difference.
For Lisa Brackbill, the day her life changed forever can be traced back to this one photo, a picture showing her wide-eyed baby girl Tori smiling for the last time.
It was truly like a switch had flipped.
It was January 2015 when their happy, seemingly healthy 5-month-old stopped progressing, seemed to be in constant pain, clenching her little fists and crying. 6 weeks after that final smile, a diagnosis, something called Krabbe disease, a rare disorder that would take Tori within a year.
We loved her even more in a different way, a more fierce way, after we found out that we weren't going to have her for very long.
As the Brackbills began a baby bucket list, they discovered the disease that ended Tori's life could have been caught in newborn screening. That's the heel prick testing done on babies across the U.S. When Tori was born, Krabbe wasn't on Pennsylvania's screening panel where the Brackbills live, but it was being tested for just over the border in New York.
And if our daughter had been born just 3 hours north, we would be living a totally different story.
The kind of story our national investigative team found families nationwide are living. We discovered disparities in newborn screening from state to state, creating a tragic phenomenon known as death by zip code, with where you live dictating what babies are tested for at birth. Krabbe, we found, is now included in screenings done in at least 10 states, but it's not yet on a recommended list of tests the federal government wants to be uniform nationwide, something Lisa has vowed to change in her daughter's honor.
I knew that for me, advocacy is how I continue to be her mom.
It's advocacy for newborn screening that experts say is critical to finding rare conditions early and saving babies' lives.
Generally, you don't catch anything, but when you do, you've just made such a difference.
Right now, 37 core conditions are recommended by the federal government, but we found not a single state in the U.S. tests for all of them. That's something pediatrician and Congresswoman Kim Schreier and other lawmakers want to change by 2025. To make that happen, they called on congressional leaders in this recent letter to prioritize funding and appropriations for newborn screening.
You know, whether you get these newborn screens shouldn't depend on what state you happen to live in.
States decide for themselves which testing they'll carry out. They also foot the cost of the work, with some help from the federal government. There's a bill in Congress, the Newborn Screening Saves Lives Reauthorization Act, which should funnel millions to state screening. But it's repeatedly been held up in recent years because of debate about research using the baby blood samples.
It's incredibly frustrating to the advocacy community because so much is tied to that funding.
The federal funding helps fill the gaps in state budgets and inside state labs that we've learned are already stretched thin, with screening programs filling the pinch as more and more conditions are added, either because of federal recommendations or through individual state mandates. Our national investigative team spent months contacting every state health department across the nation, asking their biggest challenges when it comes to keeping up with those new additions. 43 states and D.C. responded. Almost half told us funding and staff shortages are their greatest hurdles. Difficulties finding equipment, lack of lab space, and quality control for testing were also major concerns. Among the most striking responses, Illinois, where the health department told us if they keep adding new conditions without more funding, it would compromise their ability to run the screening program. Michigan, which said state programs struggle to effectively recruit, train, and maintain lab staff. And Hawaii, which told us some states don't have the specialists they need to test for newer conditions, and that quality assurance is hard to do when they have to chase to add new disorders.
It's very challenging.
Especially for people like Susan Tanksley, who runs the Texas state lab that handles their newborn screening and knows the difficulties faced by screening programs across the nation.
Failing is not an option because the babies we're serving, the families we're serving are incredibly important. So we have to succeed.
Is that an airplane?
Success for moms like Lisa Brackbill, who's watched newborn screening grow and change like her own family, means getting programs the money they need to one day eliminate disparities altogether, closing yet another health divide that impacts our most vulnerable.